Hey, everybody. Welcome to Here's the Thing. I am your host, Keisha, and tonight joining me as co host is my friend, Ian. Ian is a writer producer who is more than familiar with what we're talking about tonight. And tonight we are talking about health insurance. It has been all over the headlines with the talk of the Obamacare, AKA Affordable Care Act, premium subsidies ending as of January 1st. And the government shutdown deal has nothing to do with subsidies. It's all about SNAP benefits, which is great. I'm glad people are getting fed, but now we have the problem of health insurance issues. As of January 1st, 22 million people could see their premiums rise overnight. And supposedly Congress is going to revisit this issue in December, but who knows? Mike Johnson is saying he doesn't even want to talk about it. So who knows what's going to happen? But let's get into these subsidies and why losing them would be hard for so many people. Before we actually talk about subsidies, it would be good to have an explainer about the Affordable Care Act. So here we go.
Everyone wants quality health insurance that doesn't break the bank. But for a long time, many Americans who didn't get coverage through their employer couldn't afford it on their own, especially if they had a pre-existing condition. The Affordable Care Act was created to change all that by making health insurance less expensive, making it easier to compare plans, improving coverage, and protecting consumers. How did the Affordable Care Act, or ACA, help consumers like you? For starters, the ACA, also known as Obamacare, was largely about lowering the cost of health insurance. It created income-based subsidies that lower premiums and out-of-pocket costs. It also expanded Medicaid eligibility to help millions of low-income Americans get coverage. The ACA also made it easier to shop for insurance. Marketplaces in every state offer standardized coverage levels, bronze, silver, gold, and platinum, that let you better understand the costs of each health plan. Another benefit? The ACA dramatically improved coverage. Before the ACA, your insurance plan didn't have to cover expenses that seem obvious. Now, health plans must include 10 essential health benefits like preventive care, visits to your doctor, mental health, maternity and newborn care, and more. That's not all. The ACA created key consumer protections, including a rule that you can't be denied coverage or charged more because you have a pre-existing health condition.
So that's what the ACA is. I figured it was good to have a reminder. And let's talk about what it would mean to lose these subsidies. This is where the problem starts. So, according to Politico, this article titled Congress's Obamacare Subsidy Vote Could Set Off a State Scramble. The enhanced subsidies were first created in 2021 under President Joe Biden to further lower the cost of Obamacare premiums during the pandemic for a pool that includes higher income Americans who were not previously eligible. It also ensured that some low income Americans paid nothing in premiums. The enhanced subsidies have greatly limited out of pocket costs for ACA consumers, and they removed an income cap of 400%, ensuring no one would pay more than 8.5% of their household income on health insurance, no matter how much they earned. Have you used Obamacare before?
I have not used it yet. No, but I have family members on it. I have friends that use it, and I hear a lot about how it's helped them.
Yes, it has helped me in the past when I was laid off from a job. I talked in the previous episode about how I was laid off 4 times. And one of those times I didn't have health insurance at all. That was pre-Obamacare. And during the third layoff, I had Obamacare, and it was a godsend because I had to go to therapy to deal with the trauma of being laid off again.
Yes.
And
Yes.
Obamacare made that possible. So I am a fan of Obamacare, and I would hate to see that people can't afford their health insurance because these subsidies end.
Yeah, no, I mean, I have so much, like, even watching those videos, it's atrocious to me because I have friends that don't have chronic illnesses, but then I do have a group of friends who have chronic illnesses. And me and them, we all take specialty medications. And even with the subsidies, you have to get the best possible plan to get to qualify for these specialty medications. And so I have a friend who had an Obamacare plan, which is like $1,000 that was with the subsidy. Without the subsidy, it was like $1,600. So it's still crazy. It's still a lot of money, but I think that's a good example of how the system's already incredibly broken. But this does give a Band-Aid. This does give something to people who need it. And I don't know, even watching that video, I'm just like, the fact that it's even a consideration to say that it was a consideration to say, well, you have a pre-existing condition, so you won't be able to get this particular insurance. We can't get covered because you have a pre-existing condition. That term is insane. It's just that alone, the idea of you have a pre-existing condition. It's like, yeah, we all have pre-existing conditions. Like, we're human. We're born into a body with conditions. It's like, it's a disgusting term to me.
Yeah, and there's some insurance plans that wouldn't cover maternity care as like a default.
Mhm.
So it was almost like being able to birth children is a pre-existing condition.
Right. And this is something and I know we are going to potentially talk about it later too, but like the ACA was what, 2008 it was introduced, 2009 it was passed, I think 2009 or 2010. Before that I didn't have my own insurance plan, so I didn't think much about any of this. I was just like, oh, you just get a health insurance and that's it. That's it. Like, I just wasn't aware of the actual system itself. So I didn't realize how insane it was before the ACA, before Obamacare, pre-existing conditions. The idea that you couldn't, it was Obamacare that put you where you can wait until you're 26 to get your own coverage, that you could actually stay on your parents' plan. I had someone in my family say, what did Obama actually do anyway as a president? And I was like, that right alone should be the answer that anyone gives. Alone, like there's plenty of other things we can talk about, but that alone was major, the ACA.
Yeah, I missed out on that 26 limit for
Okay.
your parents' insurance. I mean, I'm happy for people that were able to take advantage of that and are able to take advantage of it. And I'm like, damn it, why now?
Right. You should have. Right. Maybe they can put it in for you later.
Yeah, it's okay. I have
Okay.
my own insurance and have to deal with my own adult problems. But
That's
I
not
did
fair.
want to I did want to share a video of some people reacting to the possible increase in premiums.
We were paying, I thought already, an obscene amount of money, like $700 some dollars.
Hmm.
And the plan is $1,259 a month.
We just got our benefits for next year. What I'm currently paying $240 every 2 weeks for is going up to $709 every 2 weeks. How can I possibly survive paying $1,500 just in medical coverage?
Mine went up $230 a month. I don't think I can pay that. I might be having to go without health insurance.
I just logged in to our health insurance to see what, if we stay on the same plan, what our premium is going to be for 2026. $1,208.91 a month. I don't know if we can keep our heads above water next year.
I found out today from the marketplace that instead of paying $650 a month for health insurance for my son and me, I'm now going to be paying, with my current plan, $1,151 and some cents per month for my monthly premium. This is why Democrats haven't signed the bill. This is why they're refusing to sign, because they knew that people like me were going to see our health insurance premiums double without the subsidies, the premium tax credits.
So obviously, he reported that before the 7 Democrats and 1 independent joined in with the Republicans to end the shutdown. But that's wild. It's like you were saying, you have friends who pay like $1,000 a month in health insurance, and that's in some places a rent payment or half of a rent payment, 2 car payments. Like that's an insane amount of money. And that's with the Obamacare plan.
Yeah, it is insane, and I have seen people who also are able to get, oh, instead of paying 1,000 a month with the subsidies, they're paying 300 a month. So I have seen that too, which is that is a huge, like, I've seen various situations, but in every case the subsidies help. And I think even when I was watching that, I was just like, what is the argument here? And like for not extending this. And I know that sounds obvious, like, well, Ian, like we know what the argument is, like it's greed. I get that, but like what is the actual like optics argument that the Republicans are saying? Because all they say is yeah, we need to fix the system, and then they say, well, we'll get to it. We're going to figure that out. And it's like, that's what we're going to talk about. It's like, well, what in life do you do that with? Where you're like, you know what, let's slash everything first, then we'll figure it out. It's like, that's like moving out of your apartment and being like, well, now I'll figure out where to live, after I move, and we're right when I move out. It's like, that's insanely destructive to anybody. But the thing is, in that case, when they say these things, it's like, I know you're just saying this. I know you don't actually have a plan. And I think there's something even more insidious about that. But yeah.
Or like Trump, he has a concept of a plan.
Right.
I can't believe he was able to get away with saying that.
Yeah. Yes, exactly.
There's a video of two congressmen debating this, and it's a Democratic congressman. I think it was Joe Neguse. And I don't remember the Republican congressman's name, but he was like, what do you have against these premiums? And the Republican congressperson was like, the premiums make insurance more expensive. And the Democrat was like, how do the premiums that make it less expensive for people make health insurance more expensive?
Right.
And the guy had no answer.
Right. In what situation would this work? I mean, if you at your job, if your boss is like, hey, we're thinking of doing this, and you're like, no, I don't want to do that. I think we should scrap everything we were doing. I have an idea though. And they're like, great, what's your idea? And you Keisha, you're like, I'm gonna tell you. And it's like, okay, well, just say it now. Why aren't you saying it now? It's like that. Nobody would get away with this. And I feel like I'm crazy every time I watch any of this stuff. And I know we all are kind of collectively feeling that, but it's I'm very annoyed at all of this.
Yeah, a lot of people are. I have a video of Rachel Maddow explaining exactly what the details are for the increase in premiums.
I mean, these are insane numbers. States are now starting to release the actual numbers on what the Republicans' policy changes have done to health insurance costs with this legislation that they've passed this year. This is what the Democrats have been making a stink about. You've heard, like, Democrats are concerned in the shutdown fight about healthcare costs and health insurance, and you think like, oh, Democrats are always concerned about health costs. That's nice. I care about health costs. I'm glad they're standing up for it. No, it's this specific thing. You want to know what the Democrats are making a stink about with the shutdown? You want to know what the Democratic side is of the fight over the shutdown? Look at these numbers from the New York Times tonight. Look at this. This is for the tens of millions of Americans who get their health insurance through the online marketplaces. Look. Based on the newly posted information, meaning the pricing information that's now being posted in multiple states, a family of four making $130,000 in Maine. So you combine the family's income, everybody's salaries, you got up to $130,000. That family would face an increase in their annual health insurance premiums next year of $16,100. That's how much their health insurance premiums would go up. But maybe that's, that sounds like it's a fairly well-off family. And you think, oh, well, maybe that doesn't apply to me. I'm not quite in that kind of a bracket. Well, imagine you're in a couple, you're each 60 years old, and you put both of your salaries together combined, you make $85,000 a year. So maybe one of you's making 40 grand a year, maybe one of you's making $45,000 a year. Combined, your couple's income is $85,000 a year. In Maryland, your insurance premium is going to go up by $13,700. In Minnesota, your insurance is going to go up by $15,500. In Nevada, it's going to go up by $18,100. In Kentucky, the increase for you guys as a couple will be that you are expected to pay an additional $23,700 per year. That is the amount of increase we are looking at in people's health insurance premiums. Can your family afford just randomly an additional charge of $24,000 for exactly what you're getting right now for $24,000 less than that? I mean, these are insane numbers. But this is what Republicans, in their policy changes on healthcare, what they have done to health insurance costs. And this specifically is what Democrats have been screaming bloody murder about. This is what Democrats have been drawing the line about in this shutdown, telling Republicans that this is the thing they need to fix. Think they're going to fix it? Think they will? President Trump doesn't appear real focused on it.
Mhm.
Yeah.
Yeah, and my first thought with that is, and I mentioned it briefly before, and it's good because the wages for everyone is going to go up just as much, right?
Yeah, I heard
like-
about that. Everyone's getting
Yeah.
like a super bonus.
That's great. Yeah. That's yep. Super bonus would be wonderful. I thought that every single year, even just with inflation alone, I was like, shouldn't wages be going up matching inflation? It's like, no, it's not doing that. Should wages be going up with healthcare costs? Nope, it's not doing that either. So,
Yeah.
okay.
And I work for a company where we don't do cost of living adjustments for salaries. That's fun too.
I couldn't help but when I watched that also, I couldn't help but think of a C-suite executive that I once worked for, who I will not name, who I remember saying in a all hands meeting about health insurance at the company. And this is a C-suite executive. And he said, guys, I just want to let you know you have questions about health insurance, but I just want to let you know, I'm on the same plan you are. I'm paying the same amount you are. And I remember hearing that at the time and thinking, wow, that's really cool. Like we're all in the same boat. We're on the same plan. And it was only in the last few weeks when I actually went to a PNHP, which is Physicians for a National Healthcare Program event. And one of the person who put a legislation up for the New York Health Act was talking about this idea of salaries reflecting how much also you would pay for your health insurance and how much you can afford. And I couldn't help but think, oh yeah, when that C-suite executive said that, I was like praising him, only realizing, wait, you're making like 10 times how much I'm making. Shouldn't we actually be paying a different amount in our health insurance to make this fair? But the answer is no.
Yeah.
I guess not.
Yeah, it's a nice sentiment, but it just doesn't really hit.
No, it doesn't.
So let's talk about you. I invited you on the show because I saw your Instagram post or your Instagram story where you shared your COBRA premium, and it was insane. Do you want to tell us about that?
Sure. Yeah. I was laid off from my job in January 2025, and I got on COBRA pretty quickly. And the first thing I'll say about this is that there's an argument of, okay, why don't you just do an ACA plan? But as I briefly mentioned before, if I do an ACA plan, I need specialty medication covered, and I'll likely get a worse plan for paying more in order to still get my specialty medication. So the best route I could go is COBRA in order to keep my specialty medication, keep the good plan that I have from the job. So my COBRA premium coming out of that job, coming out of the layoff is $1,096 a month. That's as an individual. $1,096 a month as an individual. I've been paying that since the layoff, and I got a notice in the mail that two things happened. One is the administrator of the COBRA of the Consolidated Omnibus Reconciliation Act. The administrator of COBRA is changing. It's changing from one company to another company, and the other company is some vague name that goes under the name just billing services, and they're very hard to track down. So that's its own strange part of all of this. But I read it and it said the premiums increase for 2026. Okay, so $1,096 for 2025. 2026, now with medical, vision, and dental, it is now $1,500, $1,507.34 every single month premium. That's so 1507.34. Medical alone is 1439 a month premium. So this is premium once a month. So that means per year, that's $18,000 a year plus in just premiums alone. That has nothing to do with deductible or out-of-pocket maximum. That's just premiums. That's just to get the insurance. And there's not much breathing room because, as I said, ACA, especially now with the subsidies, it's pointless to go on the ACA. And then maybe there's an argument of get Medicaid. Well, no, that's an issue with specialty medication as well. And there's an income limit there. And so it's Medicaid, ACA, or no insurance, which as someone, especially with a chronic illness, having no insurance is a very, very bad idea. And I could pay $18,000 in premiums for the year, or I can risk no insurance, but take a huge risk in maybe paying a $80,000 emergency hospital bill if I go to the hospital with a bowel obstruction. So, yes.
So did they explain or offer any explanation for why it's going up? That's like 50% almost.
That's a really good question. That's an excellent question. And all I read, and I have all the sheets here. I'm not going to read all the sheets, but all they say in the sheets is the main thing says, it's essentially what's going to happen. It's COBRA premium payments when they're due, when they're due, and what's going to happen with your premium. There's no why. There's sort of how is this going to happen, how, what, and when, but there's no why. And why is a great question. And if I immediately, even when I called them to just ask about setting this up, I was met with just like defensiveness and just a clear, like, not wanting to be on the phone too long from their end. There's really not, yeah. And, but it's a great question because I could ask why. I could say, why is this increasing? They'll very likely say, well, this is just this is what the plan is for the administrator and the company. This is just what the cost is, and this is what the plan, they'll repeat, this is what it is, as opposed to saying like, well, the real reason is because we want more profits. We want more money coming in.
So there is an article from this organization called AFF. It's a nonprofit focused on health policy.
Is that the Kaiser Family Foundation?
Yes.
Okay. Yeah.
Are you familiar?
Yes. Yeah. Yeah. To some extent. Yeah.
They said that just in the ACA marketplace, insurers are proposing to raise their rates by a median of 18%, fueled by rising healthcare costs and the expiration of the enhanced premium tax credits. They are proposing the largest rate increase in 2026 since 2018, which was the last time uncertainty over federal policy changes contributed to sharp premium increases. So it seems like some of this might have something to do with rising healthcare costs, and some with just them not being sure what's going to happen with these premium subsidies.
Yeah.
So, I mean, this seems like extortion, honestly. Like
it does. And that's an interesting thing you bring up too, because it's like, from the insurance company's perspective, it's like, well, what are we going to do? We still need to make money too. What do you expect us to do? And it's like, yeah, you're right. You can do this. Technically you're allowed to do this, but it's a reminder about like, oh, right. I was thinking about this a lot because I had a discussion once with somebody about who was arguing for why CEOs make as much as they do. And his argument was, well, that's what the market demands. That's what the market dictates. And it's like a free market system. And that's what it dictates. And that's just what it is. And it's like he was sort of saying, like, take the emotion out. This is just what the market is. And I get that that's probably the argument here too. Is like, this is what the market is. The insurance companies need to do this. And that's just what it's like. Okay. But like, I thought like collectively as a civilization, maybe, or as a country, maybe we would just try and, look out for each other to some extent, but a compassion is kind of taken out of the picture. Not kind of, it is taken out of the picture. So, or an understanding that you're going to kill people or bankrupt people from doing this, by doing this,
Yeah, and we'll talk about people's reactions to health insurance companies in a little bit, but I'm curious,
Mhm.
when you got this letter, do you open up the mail, you get this letter, what was your first reaction?
I was like, okay, yep. Honestly, I wasn't that shocked. It hit me because I'm like, okay, that's $400 extra, and I'm currently technically unemployed. I have freelance work, but it's minimal, and uh, but I opened it with like, yep, that's what I expect. Like I'm not shocked by much anymore. I mean, if I opened that and it said $5,000 a month, I would have been shocked. I would have been like, yeah, that tracks, but I would have been shocked. This was like, yep, that's sort of what I figured anyway. Um, yeah, it wasn't it's crazy, but it wasn't a crazy surprise.
How much of your life do you feel is determined by your health insurance situation?
Most of it, honestly. I think I most of it, because I not only need health insurance, I need good health insurance. I mean, we all need good health insurance, but I'm 34. There are people my age who probably cannot have health insurance and like go the year and be fine without ever even maybe never go to the doctor. I need to go to the doctor. I need to get probably at least a colonoscopy a year. Um, yeah, I need an MRI. I need to check in on where my Crohn's is, and my specialty medication. I take two immunosuppressants, Skyrizi and Rinvoq, and without insurance, those medications, you can look them up, are obscenely priced.
Is another
This is
issue altogether.
yeah, that's another. You're right. That's another issue altogether, because and that becomes a war between the drug makers and then the health insurance companies, who yell at each other and be like, you're the villain. No, you're the villain. And it's like, okay, well, we're all just getting screwed while you guys are yelling at each other. So to answer your question, it's everything. I mean, health insurance at this point is everything, and it's essentially life or death. And uh, yeah, yeah, and this country seems to be pushing people out, and being like, uh, go find somewhere else to go. Feels like that at
Yeah.
least.
Well, I'm sorry that you have to deal with this. This is it's absurd. And
Thank you. Yeah, and this is not even meant to be me complaining as much as just like this is just crazy. Like this is just like I'm not even seeking pity or any. It's like um having friends also in the same boat. It's just like, and also knowing like we're all kind of on the same road together. That this country does not look out for even people our ages, but also just elderly. As you get older and older, you think this country cares about when you're 80 years old, unless you're wealthy. Um, so it's making me envision what this road actually looks like in getting old in this country, and if that's worth it.
yeah, which is another topic I discussed in my first
Yes.
episode is the American
Yes,
dream.
yes, that's right.
Well, thank-
I do. Yeah.
it seems like across generations, one thing people can agree on is that our healthcare system sucks, that the health insurance
Mhm.
system is not great. We talked about the ACA, and you mentioned that you had a friend who asked what Obama ever did. And the ACA is not perfect. There was more that they wanted for that plan. I believe he actually wanted universal health care.
There's a public option that was I believe Joe Lieberman was the one that put the final nail in the coffin for a public option not happening. So you're right. Yeah, there was potential for that.
Thanks, Joe. It's fucking great.
Yeah.
But I'm grateful for things like what we mentioned, that being able to be on your parents' insurance till you're 26. I didn't get to benefit from that, but that's fine. I'm not one to be like, well, I didn't get to have it, so nobody should. But I had a friend who got into a bad car accident many years ago. She was sitting in her car, like paying bills or something, and someone hit her. And they were going really fast because it turns out the person who was driving had like a seizure. And she was in the hospital for months. Like she nearly died. She had to have all this like reconstructive surgery done, repaired her organs, all this stuff. And at the time, this is pre-ACA, pre-Obamacare, there were lifetime maximums on insurance. And she hit the maximum because of all of these treatments that she had to have, and was therefore uninsurable after that. It was, and then talking about
Wow.
existing conditions, which is now covered under the ACA, she also was uninsurable because of the fact that she now had these pre-existing conditions from being in this car accident and having all these things that she had to have done. So when I think about people like her who've had to go through such horrific things and hit up against the wall with these ridiculous rules, I'm grateful that we have what we have and we need more. And what we should not be talking about is taking it away. We should be talking about how we can make it more robust and make it more affordable for other people.
I wasn't even aware of a lifetime maximum because I think I wasn't in the system at that time, so I wasn't aware of that. And what I mean, I'm so sorry for your friend, and I hope they're doing okay now. But that's honestly what this makes me think of. That story is in general is this idea of you don't know if you don't know what it was like before. I mean, we could even talk about what is it like now and how can we make it better. But if you don't know what was like before, it's like there has been progress, as you're saying. It has gotten better, but I think Bernie Sanders put it as like they just keep tinkering with it as opposed to really doing an overhaul. It's just kind of like it's like a bunch of holes, and you're just like, oh, let's plug this one and let's plug this one temporarily and plug this. Like you have to really redo the whole thing, which is not easy. But it also makes me think of, and this is just a side note, of like the people who don't want to get vaccinated for measles. And it's like, well, do you know what life was like when people did get measles? Were you aware of what that looked like and what the benefits of vaccines were to that? And if you don't, it's hard to advocate for it because you don't really know the damage it can do. And so what you're saying, like a lifetime maximum is I had no idea it existed, and that's crazy.
Yeah, it's nuts. And the other thing with insurance is it's not just patients who have issues with it, it's also doctors.
Yes.
Like you and I have talked about having mental health professionals who don't take insurance.
Yeah.
And my therapist, who I've been seeing for years, told me that I'm her last patient that she accepts insurance for. And as of January 1st, she just cannot deal with that anymore. So she has cut ties with them. And if I want to keep seeing her, I'm going to have to pay $300 a session as opposed to like a tenth of that with a copay. So I'm like, this is just another way that the health insurance industry is screwing us over because my therapist doesn't want to deal with them because one, they're not paying her enough. They don't raise the rates often enough. It takes forever for her to get in touch with someone when she has questions about billing and invoicing.
Yep.
And then they make her jump through hoops just to get reimbursed for things. So I'm not a fan.
Yeah.
I want to play a video from a doctor who shares his feelings about the situation.
Hey man, how's it going? Well, I was supposed to do surgery today, but apparently I'm out of network, so the patient had to cancel. Out of network? What does that mean? It just means insurance won't pay for the patient to come see me for their health care. Oh, I didn't know you worked for the insurance company. What? I'm in private practice. I don't work for the insurance company. You sure? Of course I'm sure. So when you see a patient, you send a bill to the insurance company, right? Yeah. And then the insurance company will pay you for your services. Yeah, that's right. Well, who decides how much you get paid? Well, you have to sign a contract with the insurance company. Well, what happens if you don't sign the contract? You don't get paid. Huh. So you do work, and the insurance company pays you for that work, and they pay you whatever amount they decide they want to pay you for the work you're doing. Yeah. I don't know. It kind of sounds like you're working for the insurance company.
Yep.
And that's
I recently met one of my brother-in-law's friends who's an attorney for providers who are suing. They're in lawsuits with health insurance companies. So thankfully he's on the side of the providers, and because he was explaining that to me, essentially that these doctors will bill the insurance, and the insurance will be like, well, we're just not going to pay that. And it's like, okay. And they're like, go ahead, sue us. Because the giant, Weill Cornell, Mount Sinai, they can be like, all right, we're going to fight you. We'll go up against you, United Health. But if you're private practice as a provider, good luck going up just you versus a giant health company. you know, it's scary, and I think, yeah, it's hard as a patient to see the doctor's perspective too, because you're so worried about your own. But it's like we are kind of in this together to some extent. And I do sort of I'm starting to understand why a lot of doctors don't take insurance. It's not out of trying to screw the patient. It's trying to also just save themselves from a nightmare.
Yeah, so I take antidepressants because
Yeah. Same.
depression, and also this society we live in does not help. Um,
I agree.
and my psychiatrist, her initial intake appointment is $650. Yes. And every appointment, and I don't see her like that often. I see her maybe like once every couple of months, is $375. And once I meet my deductible, I'm reimbursed like 60% of that. But it's still like a lot out of pocket. And I don't fault her for not taking insurance. But she's a really good doctor, and it's been worth having to pay that, because I get really good care. And she's not limited by, well, the insurance company will only allow me to see you for 15 to 20 minutes. Like, I have a full 30-minute appointment with her when I meet with her, and she's like engaged.
That's great.
She doesn't
She's
have to
actually
worry about, yeah, she doesn't have to worry about billing and paperwork. I'm the one that, submits the claim form. So it's not perfect, but in some ways there are upsides to it for patient and doctor. So some people opt out of the system. They choose not to have health insurance, or they choose not to accept health insurance. And then you have people who just snap, like Luigi Mangioni. I think we all know what Luigi Mangioni is accused of having done last December. Can you believe it's been almost a year?
That's great. It feels like less than a year, but also more. It feels like it's been longer in a weird way too. It's yeah. That's wow. Okay.
Yeah, it was, I want to say the first week of December. He is accused of having shot and killed the CEO of United Health. Brian Thompson, I believe was his name.
Yeah.
Which, and United Health is a company that has a high percentage of claim denials. So when Luigi Mangione appeared on the scene and that man was shot and killed, there were a lot of people who were not surprised and not really upset about it. And dare I ask what you thought about what happened?
I was not surprised. I mean, I think when that happened, I was like, yeah, that's like, this is just it's too like a symptom. It's like it's a symptom of what I think a lot of people are feeling under the surface. I'm not saying like, that's a separate conversation about what happened, but like but this anger that we're all feeling, it's there. And I think it's just where it's directed and how this is solved. It's like, the stuff doesn't have to happen if you stop screwing people over. And I know that sounds like a threat in and of itself, but it's like, it's not meant to be. It's just meant to be like, hey, like, stop. We're already on the ground. A lot of us are already very sick. I thankfully was able to get surgery and get specialty medication. And there are nightmare stories I have with that. But there are countless people who, I also don't have kids. Like, I have time to figure. I'm also younger. I can time and some energy to figure this stuff out. There are people with families who just ignore health problems, I'm sure, and can't afford anything. Anyway, all this to say, like, and so when they get $5,000 bills, it's like, okay, what do you expect me to do here? So no, all that's when that happened, I wasn't shocked. And what I think amazed me too was, I think there were some fixes that I think United Healthcare started to try and have, but I don't know but that's still in place. You can correct me on that. But what was amazing to me was like the first instinct for all the CEOs was like, we better beef up security. And it's like, you're really reading the situation like that. Like, that's how you're going to read it, as opposed to like, hey, why did this happen? But because I think truthfully, they know why it happened and they don't care. That's my assumption, is that it's not like they're learning. Maybe, I mean, maybe some of them are. Maybe you're like, wow, I've been really out of touch and I've had a Scrooge moment now. But I think it's mostly like, oh no, we know that they're all sick and dying. We don't care. Like we don't see it. It's not affecting our families. So fuck them. I think that that's my assumption is what they're day to day thinking, if they're thinking of anyone at all. I think I was most amazed, like, oh, and how much has actually changed since then,
Yeah.
or gotten better.
There is a YouGov poll from December 2024, shortly after this happened.
Yeah.
And basically, adults under 30 were more likely to view Luigi more favorably than unfavorably at 39% versus 30%. And people between the ages of 30 and 40 were evenly divided at 28 and 29%. And liberal people were more likely to view Mangioni favorably than conservatives. So all the purple is the favorable and all the red is the very unfavorable. So you can see the younger people were skewing more favorable, and yeah.
Do you remember Daniel Penny? That story?
I remember
that story. Yeah. I spoke to somebody and they we were talking about it. I said, what do you think of it? They said, I think he's a hero. I said, okay. I took note of that. They said Daniel Penny's a hero. And then when the Luigi thing happened, he didn't call Luigi a hero. He said, I think it's horrible. I think it's horrible to do that to somebody. And I'm like, well, so because you know, if you try to contextualize the situation of what was happening, of you mentioned it before, these claim denials for people who are sick and dying who need help, and you're willfully refusing service to them when they're paying you to do the service for them. Is that not murder? I don't. You know, it's not as direct, but isn't that not some form of murder, or am I just stretching it too much? And that's I don't know what your thoughts are in this situation, but I you know, yeah, I can't help it.
Let's say, like, legally, like, if you are a bartender and you serve someone,
yeah,
and you serve them too much, you overserve them, and they go out, they drive a car, and they kill somebody. In some states, you can be charged with that crime as well as the bartender. So that seems like a similar kind of situation, even though with health insurance, it's more of a business transaction. You still are making a decision that can impact someone's like life outcome.
Right. And I really try. I hate to use the word both sides. I hate that phrase, but I like, there is a part of me that tries to argue, like, okay, could the CEO have saved everybody who was on insurance plans, saved everyone's life? Like, no, obviously people would have died anyway, even if they had gotten the care. But I know I can speak from my own personal experience of when I've been denied coverage and it made zero sense why. And when I'm paying $1,500 premiums, to be denied anything is, I would argue, is crazy. But you know, it's one thing. I mean, even if you were denying people who had free health care, it's still evil. But just to deny people who are paying for your service and then you're refusing the service anyway and still taking the money, it's just there's something particularly evil about that.
And not just taking the money, but like some people at the top are making absurd amounts of money.
Yes, that's right. Yeah, it's salaries that if they lose $1 million a year, if that actually went into people's pockets, it wouldn't, you know, destroy their lives. The people making $30 million a year. And I'm sure if someone watched this, they would say, "What? Oh, and the CEOs, they don't owe anybody their money." And it's like, I get it. Like the system that we live in, nobody owes anybody anything. But
it begs the question: why do we tolerate this system?
Yeah.
And back to what you said earlier about living in a civilized society, why can't we just care about each other? Like,
right. And I know the argument of like. Right, and I know the argument of it's not simple. I had a family member at a thing recently that said, like, Ian, it's not that simple to fix all this. It's like, obviously, it's not that simple to fix all this. But even if something needs fixing, you don't just say it's not simple to fix and walk away. It's like you try to, you're like, okay, let's work on this then. Let's try to figure this out. And it's like, That's too hard. It's like, okay, well then, well, like, you know,
Yeah. So this is a good time to talk about alternatives because there are places where they have better systems. But first, I want to talk about someone who opted out of health insurance altogether.
So this morning, I woke up thinking about this big, ugly bill that passed in healthcare. Last night, my husband and I were talking about it, and he told me, he said, Pam, you know, under this bill, our healthcare premium is higher. So a lot of you know that we are abroad now in Canada. We made that decision after this last election that, hey, yeah, we definitely are going to get out of the USA. We were paying $1,600 a month through Blue Cross Blue Shield in Montana to have health insurance for our family of 5. My husband made the decision to cancel that insurance, and that is what helps pay for us being here. It actually pays our rent here in Calgary. Our rent is around $1,600 USD for a 3-bedroom, 2-bath condo.
wow.
What we did in place of that was we got an expat health insurance policy that covers like catastrophic stuff. We did that because we found that paying for regular routine health visits, especially in another country, is super affordable. For example, an urgent care visit here in Canada, Calgary, Alberta, runs us about $70 USD. $70. I got my teeth cleaned recently, and I think I only paid about, I want to say $80 or something like that, $80 to $100 USD. I really need to look that back up. But it was very low compared to what I pay out of pocket in America. So what we found is that you can really cash flow the basic stuff, but you definitely really need to have something for catastrophic events, you know? So some expat insurance, no matter where you decide to live, whether it's Mexico or Thailand or where Costa Rica, you should have some type of catastrophic plan. And those plans cost way less than what we were paying for health insurance in the USA. It's very minimum. And a lot of times they'll just do it by your family size and stuff like that.
$1,600 she was paying, and now she still pays her rent. That is wild.
That's crazy. And I wonder what her rent was in the US too. So because that would have been double, I'm sure. Good for them. That's really smart, I think.
Yeah,
That's
I would love
amazing.
to be paying $1,600 for a 3-bedroom, 2-bath condo. Can you imagine?
I can't imagine. I genuinely can't. Would you consider doing what they did,
Not
moving
paying,
out, or just leaving the? I mean, I know you had a separate episode about this too, but has that been on your mind?
I've thought about it, but unless I could get like one of my family members to go with me, I wouldn't really want to do it because it's hard. It's hard. I've lived in states by myself where I didn't have family, and that was hard. So living in an entirely different country just seems hard.
Right.
If I had a partner, maybe it'd be different, and I was going with them. That would be maybe something I would consider. But by myself, I know that it would emotionally be very difficult. Even you build community, you make friends and all that. It's just still not the same as like having a sister nearby,
Yeah.
a goal nearby.
Yeah. Yeah, that's why it always sounds nice to be like, oh, let's leave the country, but it's like there's a lot that goes with that, because obviously some people are unable to leave for whatever reason, for many reasons, and then there are people like us where it's like, oh, we guess we could, but emotionally it would be a lot.
There is a ranking of countries with the best healthcare. My dog. Can you hear my dog?
Is it Ollie panting?
He's like hacking up water. Why he
Oh.
Thank you for that noise. Appreciate it. Everyone wants to hear you hacking up your water.
Yeah,
I hope
I don't mind.
you're okay. I have an article from NBC News. This chart's kind of crazy, but if you look at the top left, 1 to 10, so 1 is great, 10 is sucky. And at the bottom, they have these different categories. So they have care access, care process,
Oh, that's
efficiency,
interesting.
equity, and outcomes. And the only place where the US ranks highly is care process. Care access, 10. Efficiency, 9. Equity, 9. Outcomes, 10.
And what care process entails what?
Care process is I had looked it up. Care process is basically like once you actually get care, like once you actually get matched with a doctor, how they take care of you, like the tests that are run, the procedures, mammograms, stuff like that. Like that's all great. But for some groups, the outcomes aren't good because then you have like Black women and the high maternal mortality rate. So that's not great. So it's a mixed bag with the care process because obviously the care process factors into outcomes. But you can see on this list, Australia ranks pretty highly. Switzerland ranks pretty highly. New Zealand, like everyone is better than us.
Yeah, everyone's better. It looks like. Yeah, this is a very interesting graph. Yeah.
It's really cool. Like you can actually isolate the countries to see how they fare on things. So it's not perfect. Like not countries, no country's perfect, but
right.
Everyone's better than us pretty much.
Yeah. Right. There's going to be downsides in some form. That's interesting. Also, with Australia's care access is also pretty bad.
Yeah, that is interesting.
Yeah.
I didn't have time to look into why that is.
Yeah, I just wonder why that is, what that looks like.
Yeah.
Wow.
For people watching, I will share the link for this in the description so you can play with this graph yourself. So the US ranked last in critical areas, including preventing deaths, like Jesus, access to care, mainly due to high cost, equity, meaning low income people are often unable to afford care, and they report discrimination. And the US also ranked second to last in efficiency due to administrative complexity. And despite spending nearly twice as much on healthcare, about 18% of our gross domestic product, than any other nation, the US has the lowest life expectancy and the most avoidable deaths. Yay, us.
That tracks.
The countries that ranked in the top 3 overall were Australia, the Netherlands, and the UK. And the US ranks second behind New Zealand in care process, which measures things like preventative services, mammograms, flu shots, et cetera, and patient engagement. And the core problem is experts point to the lack of universal healthcare coverage as a critical difference between the US and other countries.
Yeah.
USA.
USA. Yeah, that's I think that's what someone had said. It's just like, stop saying that this is like what you're doing now, the USA chanting, like we're the first, not even the best country, but just like this idea of we're so modernized and so first in everything we do. It's like we're so clearly not. I mean, that's just a side note about like public transit and high-speed rail and all those possibilities, but we're so behind. And I think what's hard is that, I mean, I guess it's just gaslighting, like pretending like, no, we're actually still really good. It's like, but we're not. And I don't know. There's a mixed thing that goes in my mind where it's like what you talked about before, where there has been progress, but it's progress on some weird alternate timeline that shouldn't exist. It's like when you talk about the ACA getting better, it's like, yeah, the ACA is better than what was before, but this is like an alternate timeline that shouldn't have been the thing that happened. Whereas if you go back to the 30s and the New Deal and what was starting to be promised at that point, which were, yes, socialist or democratic socialist ideas of Social Security, it was meant to look out for us and have us thrive. And I don't know. Yeah, it's USA.
So I want to talk about what universal healthcare actually is, and there's a great video clip from the Higher Learning podcast with Emma Vigland.
Yes,
Yeah. So she explains single payer healthcare.
If someone, an American citizen, asked you, the people that I vote for can't seem to get the healthcare fight right. Why don't I have healthcare?
I would say that there is a mafia middleman in between you and your healthcare, and that mafia middleman is the health insurance industry, where there is really no reason for them to take a cut at all. We could have a single payer, that could be the government, that would create the largest risk pool, which makes it so healthcare would be cheaper because everybody would be included, right? We could have a single payer that would cut out essentially the profit incentive in between you and your healthcare. That's how they function. It's like how mobsters operate, where they take a cut out of your business in exchange for some sort of protection. But in this instance, it's for profit. And so that's how I would explain it to people.
When you talk about single payer, the retort is always, well, if that happens, the quality of care goes down, you get backed up. That competition is what keeps American healthcare on the cutting edge. To that, you say what?
Well, I would say that our life expectancy numbers dragging behind those other countries, and
China's caught up.
Oh, China's like building glue for bones. It's just, I'm like not even joking. They are way ahead of us on so many things. And that's because they have a strong central state that directs that kind of investment. I'm not saying the Chinese government is perfect, but we believe in laissez-faire economics which is just profit incentive. Just a quick aside, like these mRNA vaccinations, they happened really quickly, the COVID ones, because of state investment. We could be doing that for things like cancer research. mRNA shows promise with cancer research, for example. But because there isn't a profit motive for these pharmaceutical companies, they're not going to pursue it without a big injection of funds from the government. But I would say that, yes, our life expectancy is lower than industrialized nations that have universal health care. Our maternal mortality rate is higher than those countries, specifically for women of color and for people on the front lines of society. And that there will always be the opportunity for wealthy people to get their bespoke health care and to go to the best surgeons. It's not untrue that the United States does have the best health care if you are a millionaire if you can afford it, because, well, at least until recently, our universities used to be like these beacons of education and research, and people would want to come here and have our facilities and institutions, and the Trump administration is trying to do away with that too. So that would be my argument, is that none of the actual tangible statistics about our healthcare outcomes would support that our system is more efficient or anything close to that.
So what do you think?
She makes really good points. I have so many thoughts about this because I for so long I am for a government-run healthcare, but it should go without saying that I want a single payer system that works well. Like, because I think that's what gets difficult with it, is that, I mean, we see it in New York, right, where it's like the state itself does run certain things, and I mean the first thing I point to in this is the Department of Labor. I have a lot of issues with the Department of Labor, and that's a public run administration. And I have a lot of issues with it. So so I know people don't like government run systems. It's like, what, you want government to control everything? It's like, in the case of healthcare, yes, but I want it to run well. Obviously I would want it to run efficiently. And if it's not, then that's not necessarily better. But what she was saying, what's happening now is bad. How it's being run now is atrocious. So it's not working. And I guess there's a question for you too. If the private sector worked really well and was affordable, and we could actually get really good health care, and it was working, and low income people were able to afford it, then all right, maybe I'm for the private sector, but it's clearly not working, and greed has incentivized way too much. So it's so yes, I would like to see a single payer system, one that works well, but also like just affordability wise, I would happily pay $1,500 a month in taxes then. If that in that it wouldn't even probably be that, but if it was, rather than paying a $1,500 a month premium, fine, you know what, raise my taxes that, and that way I don't have to meet a deductible, I don't have to pay for specialty medication. That's my only cost, is that. That's still really expensive, but it's with the $1,500 premium plus the deductible, plus out-of-pocket max, plus medication costs. It's like, you know what I mean? Like I'm happy
Yeah,
a
I
portion of
mean,
that is just for taxes. So we
I feel like
collected,
I pay more taxes than some rich people, and what the fuck am I getting for my money?
right,
Am I paying for Donald Trump to rob us blind? Like,
right,
if I'm
right,
gonna pay this much in taxes, let it go to healthcare.
yeah,
Let it go to things that are actually tangibly, like, that I can see tangibly.
yeah. I mean, we pay firefighters publicly funded, right? Like they like for for taxes, like that's hopefully that doesn't ever get privatized. I could easily see that happening too, or only the wealthy can afford firefighters to come to their house and put out a fire. I can easily see that happening in this country, and that's what's sad. But yeah, in my lifetime, I would like to see a single payer system, um,
Do you
just
think
so
we
we
will?
all. It's sad that my first instinct is no. But that's that's the cynical part of me. But that also, you know, I need to see. I guess I need to see promise of it first. I guess, but that's my own cynicism. Do you think we will? What do you think?
I think we will. I think that, I mean, shit, I might be 70 by the time it happens, but I think we
Yeah.
will. I think it is gonna be hard because there are going to be people who are gonna fight against it because of greed and because of the whole capitalism of it all,
Right.
and because of the lobbyists and all the politics, and then people who are worried about government being involved in their healthcare. But I think that it'll happen, and I think there will be some benefits. I don't think anything's gonna be perfect, but I what we have now is not working, we have to do something different.
Yeah, and it's like beyond even not working. It's like it's like not working. I think is like, it's incompetent. It's like it's bankrupting people. It's killing people. Like it's not working times 1,000. And it's like I think that's what's frustrating. Is like we all see it being terrible, and we just want someone to be like, someone who has a platform to actually change it, to actually step up and do it. I mean, that's why I've been very into the New York Health Act, which is all for getting. I mean, that's it's a little more extreme, but banning private insurance from New York. That's at least with New York, is being like, all right, you're done. No more private insurance. We're all just going to be covered here, and you won't have to have these issues of what insurance am I going to be on this year and the next year.
Who is
Yeah,
behind this?
the New York Health Act. Well, that's been so. There are a few different people that there was what's his Gottfried, Assemblyman Gottfried, I think is his name. Introduced it. He introduced it into the assembly in 1991. So I think he was the one who wrote it.
Holy,
Yeah, Gottfried is the primary sponsor of the New York Health Act, introduced 30 years ago to create a single-payer universal system in New York State. And I know it is a bit selfish to be like, I just want to pass to New York. I would love it if this was a countrywide, uh, federal system, a single-payer system. But at the very least, I think I'm just like, all right, could we do a small win here in New York? Is that possible? At least just to start. But
and that's how things kind of take off in this country sometimes, right? Like,
right,
it works
right,
in one state, other states adopt it, and then eventually it becomes federalized.
right.
So, I don't know. Over the past several years, I feel like I've become more radicalized, and not in a terroristic way, in
Yeah,
a we have to do something different. We have to have something better.
yeah.
So, if it's a democratic socialist, oh my god, I'm gonna vote for him. This New York Health Act?
It's a New York Health Act, which actually Mamdani was on. He actually did videos when he was an actor. He acted in some of their videos in like 2017. You can find it on YouTube of Zoran Mamdani in New York Health Act videos. To anybody, and this is a side note, but to anybody who says like, oh, like that's never going to happen, what, you know, New York Health Act or you know, free buses, whatever you want to talk about. It's like, well, at least he's reaching for these things, and that's my argument. Is all at least he's trying for this, as opposed to I have a strong assumption Cuomo would not have aimed in any direction to try to pass any of this or to try to fix healthcare in New York.
No, he wants to do the same old shit that has been
Yes.
happening for decades. Like we don't need that. We need something new.
Someone argued, well, at least he has experience though. And it's like, well, does it matter if you have experience if you're not good at what you're doing?
Yeah, and he has experience doing a lot of things. Not all of them are good.
Yes, some he could be in prison for. That's a separate
Yeah.
conversation. Yeah.
Let's go with the Democratic Socialist. All right. Enough of the existential dread. Let's move on to the rapid fire grab bag segment. This is the palate cleanser to end the show.
Okay.
So I got some wholesome stuff in honor of you being a cat owner.
Ooh.
You're here again. You are. Do you want to sing again? So no singing today? Yeah.
That's pretty great.
So cool. Do you want to sing? Again? Okay. Okay, let's sing. Again. A whole new
What?
fantastic poem. No one to tell us. No one to tell us. Oh, where to... Okay. Or say we're only dreaming. A whole new world. A dazzling place I never. But when I'm way up here, it's crystal clear. And now I'm in a whole new world. Yeah.
How cute is this cat?
That's amazing. It's not. It was, and it's not even just the timing that the cat has right. It's like the melodically hitting some of the notes. That's insane.
It's so
I have
cute.
to. That I think I have to get.
One of your cats.
Let's see if this is Borgie.
Hi, Borgie. Hi, Borgie. You want to sing, Borgie? You want to sing?
A whole new.
Borgie, sing. Does she talk?
He's a lot quieter. George is the more vocal one because George is obsessed with food. But okay, I'll put you down. Thank you.
Cute.
He's always dressed so formally too.
He is. I used to have a very formally dressed cat too.
It's pretty great.
And then I have something weird to show.
Okay.
So this is happening in Argentina. A shelf cloud. Have you ever seen anything like that?
No. What is bringing intense winds to show? That's so it's not, that's not smoke, that's a cloud.
That is a cloud. A towering shelf cloud.
That's scary.
Yeah.
Ominous, I guess is the right word.
Ominous. The earth hates us. Yeah. Oh.
Shelf cloud is wow.
Yeah.
These clouds are ominous looking, but they're not tornadoes. Wow, but it's a sign to seek shelter. Okay.
It's a sign to shelter, you think?
Yeah. Don't run into it or okay.
And the last thing is this guy.
I did see this.
Why does he look? Is this I don't understand.
That's my first reaction was that this was like they're doing that on purpose. Because wouldn't the people producing the segment know like they look exactly the same?
You would think. I don't know.
But I mean, we all want to believe that that's real though.
Either way, I'm getting a kick out of it.
Yes, that's pretty good. That's
Um,
I guess they caught him.
They did catch him.
Yeah.
His co-anchor looks like she's looking at him like, bro, what are you even doing?
Yeah. That's
Um,
gosh.
all right, y'all, that's it for this episode. Ian, thank you so much for joining. This has been great. I appreciate the conversation.
Yeah, thanks so
Any
much, Keisha.
any final thoughts you want to share? Anything you want to plug?
I think just I've been paying a lot of attention to the New York Health Act. So yeah, New York Health Act stuff, the PNHP, which is a Physicians for National Health program. Trying to do more events with them. So yeah, follow those accounts on Instagram or wherever, and let's get a single payer system or some type of universal healthcare in the next 2 years.
Yes, I love it.
Yes.
All right. Thank y'all for watching. I will be back next Tuesday with Here's the Thing at 7:30 p.m. Eastern, 4:30 p.m. Pacific. In the meantime, on Wednesdays and Fridays, join We the People Unite, also at 7:30 p.m. Eastern, 4:30 Pacific. And don't forget to like, subscribe, comment, and share with your friends. Take care, stay curious, and if you're in the US, advocate for a better healthcare system. All right. Bye, y'all.